Hey guys, I'm SHERYL FOX, also known as the CARBADDICTION RD. As a low-carb registered dietitian, I bring different things to the table than traditional dietitians. My arrival in this space began about 5 years ago when I realized that in my own life the concept of calories in, calories out didn't work. Despite rigorous training for endurance events, I was gaining weight. The photo on the left is of me on the bike leg of an Ironman race. I couldn't train more, and I sure couldn't comfortably eat less because I was hungry all the time. Probably many of you can relate to that. I was wearing all those carb-loading pasta dinners around my waist. Acknowledging that what I had learned and practiced was all wrong was my first step toward healing, and one that I'm encouraged that you want to take since you're watching this video. The photo on the right is of me today. I will tell you this, I started by closing all my nutrition books and opening up my biochemistry books. That is where the truth lies. Our bodies are absolute miracles, and I believe it is important for my patients to have at least a basic understanding of how they process food to create energy, because I believe that knowledge is power. When you acquire knowledge, you've picked up the first tools you need to make changes in your life. But I don't want to get ahead of myself here. I'd like to define some terms because I realize there's some confusion about the differences between nutritionists and dietitians, never mind what it means to be a low-carb dietitian versus a traditional one. Okay then, what's the difference? Well, anyone can decide they are a nutritionist. For example, my Uncle Bob lost 10 pounds following the cookie diet, so now he believes he's an expert. In fact, he calls himself a nutritionist at family gatherings and will be delighted to guide you toward weight loss with his tasty plan. Look, jokes aside, there are a lot of very well-informed and really smart people who call themselves nutritionists. Except for you, Uncle Bob, sorry. But the field is unregulated. To become a registered dietitian, you have to follow a prescribed academic program, complete an unpaid internship, and pass a board exam, then follow continuing education. That doesn't make dietitians smarter than nutritionists, but it does ensure they have all been programmed with the same dogma. Now, I don't want to throw all my colleagues under the bus. 201, they're all very caring individuals who are doing their best to help their patients through times of health crises in hospitals and to navigate the confusing world of nutrition advice for those battling chronic disease. The problem lies in the inherent bias that occurs when your governing body is bought and sold by corporate interests and the science has become less than rigorous. And so traditional dietitians are limited in the tools they have at their disposal. So what exactly guides the practice of a traditional dietitian? The guiding principles are set forth by the Dietary Guidelines for Americans. These guidelines, initially proposed in 1980, were explicitly developed to guide healthy Americans in food choices so that they would remain healthy. I point this out because while their recommendations may work for, say, a healthy 18-year-old male, this plan, by their own admission, might not work for chronically ill, overweight, middle-aged adults. And this group, of course, is the group most likely to need help with their nutrition and to visit a dietitian. Okay, let's examine how a visit with a traditional dietitian might go. They'll ask you lots of questions about your medical and social history. They'll inquire what medications and supplements you take, and they may ask you to report what you ate for the last 24 hours or even for 3 days. Most will then do some fancy math based on your height and weight and whether you need to lose weight, maintain weight, or gain weight, and then tell you how many calories you should consume. Barring any physical limitations or select disease states, they will recommend that you get 150 to 300 minutes of moderate physical activity per week and probably will show you a model of the USDA MyPlate. They will emphasize how much you need to focus on heart-healthy whole grains and making sure half your plate is fruit and vegetables. You will likely be told to limit your animal protein and saturated fat, and maybe to keep your sugar intake to no more than 10% of your daily calories. All right then, what might that look like? Let's run some numbers on a hypothetical patient that is generally healthy at 5 feet 11 inches tall and weighing 200 pounds. His BMI is 27.9 kilograms per meter squared, which places him in the overweight category, so his plan would be designed for weight loss. The dietitian will whip out her calculator and tell him that his daily calorie goal should be 2,045 kilocalories, and he should aim to consume 73 grams of protein. He will be told to limit his saturated fat intake to no more than 10% of his daily calories, and the same with his sugar consumption. From a technical perspective, this works out as shown in the handy little guide I have put together here. And yes, I did hundreds of these as I trained to become a dietitian. Okay, that's a lot of numbers. Our poor patient is now more confused than ever and wants to know what to eat to follow this plan. Using the Dietary Guidelines for Americans and the USDA Nutrient Database, a traditional dietitian might recommend a meal plan that looks something like this. For breakfast, it might be recommended to have a bowl of oatmeal with some skim milk, a glass of orange juice, and a banana. He might be recommended to have a granola bar for a mid-morning snack, followed by a roast beef and American cheese sandwich on whole wheat bread with half an apple for lunch, and an afternoon snack of some celery sticks and maybe a bit of hummus. And for dinner, he might be recommended to have pasta with tomato sauce, and he could even have a small scoop of chocolate ice cream for dessert. Now, going back to the USDA Nutrient Database, we can analyze what this plan, and we see that it was revealed to be pretty good on the fruit and vegetable front. It has a good selection of those healthy whole grains, only 20.7 grams of saturated fat, and is pretty decent on the sodium front because it only has 2,600 milligrams of sodium. Unfortunately for our patient, he's spreading out a whopping 330 grams of carbohydrate throughout the day, meaning he is essentially mainlining carbohydrates and riding that insulin roller coaster throughout the day, meaning he will likely be hungry all day, meaning that he will be miserable, or he might add in some unsanctioned extras to the day. And he probably won't lose any weight, and it certainly won't be sustainable long term. Well, that sounds about right for mainstream nutrition. Now, how would this meeting go differently with me? Well, for one thing, I will ask you to throw out that traditional model. Instead, we will talk about why people, you, consume carbohydrates in the first place. Our bodies break down glucose for energy, but we are biochemical miracles. We can produce glucose out of pretty much anything, maybe even rubber bands. We are just that clever. So that means that we don't need to eat carbs. So why do we? Well, they are pretty darn delicious, aren't they? I get it, really, I do. But they are most likely the root cause of why you are seeking help from a dietitian in the first place. And that is why I view nutrition counseling through the lens of carb addiction. You don't need to eat carbs, but you do, and they're causing you harm. Therefore, we need to develop strategies to eliminate their consumption. So, unlike a traditional dietitian who recommends heart-healthy whole grains and limiting your sugar consumption, I will tell you to stop. Full stop. No one said it was easy. That's kind of how addiction works. But if you can view it in that light, it makes so much more sense. In fact, my professional turning point was the day I had to see a patient who was scheduled to have his foot amputated as a result of poorly managed diabetes. Now, obviously, I was not the first dietitian he had ever seen, but before I could even finish my introduction, he told me to leave and not come back unless I returned with donuts. I left that room with clarity and a new sense of purpose and direction. My strategy is not about everything in moderation. It's about how to eliminate that poison from your life so that you can regain your health and happiness. It's a pretty different paradigm, and I'm proud of what I do. And I'm really proud of my patients who are on this journey, one day at a time. Thank you for taking the time to listen to my story. If you're ready to change the way you view food and want to work with us, please text us at 561-517-0642 to set up an appointment. I can't wait to meet you.